সাবজেক্টটার নাম হচ্ছে ENT, তাই তো? অন্য কোনো নাম আছে সাবজেক্টের? হ্যাঁ, ঠিক, ওটো রাইনো ল্যারিঙ্গোলজি, তাই তো? তো বাইরের দেশে শর্ট ফর্মে মোটামুটি বলা হয় ওটোল্যারিঙ্গোলজি, ঠিক আছে? সেম জিনিস, ল্যারিঙ্গোলজি, ঠিক আছে? অ্যাকচুয়ালি এই সাবজেক্টটাকে এখন বলা হয় ENT হেড নেক সার্জারি, ঠিক আছে? বা ORL-HNS, মানে ওটোরাইনোল্যারিঙ্গোলজি অ্যান্ড হেড নেক সার্জারি, তাই তো? এর মধ্যে কি কি আসে সাবজেক্টের মধ্যে? টুডে ইজ জাস্ট দ্য ইন্ট্রোডাক্টরি ক্লাস, because everything builds upon your basics. Okay, the first, the basic thing is to know yourself, to know your subject, what you are going to learn. Year means what? What do you mean by year? Anybody? হাত দিয়ে দেখো, what is ear? Okay, so what are the functions of ear? Hearing and balance, তাই তো? Okay, so ear is subdivided into three parts: the external ear, middle ear, inner ear. These are the things everybody should utter. এটা তো বইয়ের কথা না, এটা সিম্পল জিনিস, ঠিক আছে? আর নোজ, সেরকম নোজ একটা রয়েছে, থ্রোট রয়েছে, তাই তো? তো subdivision or the parts of the nose or parts of the ears, parts of the larynx, all these things, these will be in your lecture classes, okay? The detailed anatomy and all, okay? So this class, the basic objective of this class, to orient you for the examination and how to be a good doctor, okay? How to see a patient with some specific complaints, right? So in this specialty of subjects, we will learn about few symptoms, about few diseases about your ear, your nose and your throat, and little bit of your head and neck, right? What are the structures in your head and neck? Important structures. You have many endocrine glands, right? What are those glands? Thyroid, parathyroid, like that. Many salivary glands, right? Right? Many nerves, many important vessels, many muscles, many bones, many things are there. So this specialty basically deals with everything from your Dura to your Plura. Okay? Dura means the covering of your brain and Plura means the covering of your lung. Okay? So anything in between that, this subject deals with that, except eye. Ophthalmology, this is a separate branch, but our specialty also deals with many things of your, like lacrimal system, optic nerve, like that, okay? Optic chiasm, all these things are being dealt by us, okay? So in your instrument, there are many surgeries we will learn about, like name some surgeries of ENT. Tracheostomy, very good answer, that should be the first answer, because this is a life-saving procedure, right? And there are many other surgeries. Name some surgeries of your ear. Ma? Name some surgeries of your ear. I know many faces who were good at answering last year. Tympanoplasty. Okay. Next. Any surgery related to Pinna? Cosmetic surgeries that can be there, right? Right? Pinnaplasty, Autoplasty, some keloid excision. ঠিক আছে? Ear piercing can be also a surgery, right? Minor holo, that is also a surgery. Next, some surgeries related to your middle ear, right? Tympanoplasty, Myringoplasty, mastoid exploration. There are many kinds of mastoid exploration, right? Stapes, surgery of stapes, okay? Stapedotomy, stapedectomy, otosclerosis surgery. Many surgeries related to your inner ear, right? Inner ear কোনো surgery নাম আছে জানা? Any surgery related to your inner ear? Cochlear implant, right? Very good. Next. Just 2 days back, it was the World Hearing Day. Why do we celebrate such a day? Because as science progresses and the lifespan is increasing, right? এখন লোকে 90 বছর 100 বছর আরামসে বাঁচে, বাঁচে তো? বাঁচে কি বাঁচে না? ডাক্তারদের কথা বলছি না, ইন জেনারেল বলছি, ডাক্তাররা কম বাঁচে, হ্যাঁ? তো hearing problems are increasing, right? Age related hearing problem, deaf and mute patient, deaf mutism, ছোট ছোট বাচ্চা কথা বলতে পারে না, বোবা গালা বাংলা যাকে বলে. So we have a solution for that, right? আমাদের যখন চোখে ক্যাটারাক্ট হয়, we replace the lens, তাই তো? তাই তো? Cochlear implant is a surgery where even if there is no functioning cochlear, this hearing cells is there, একটা functioning hearing cell নেই, we can still give the patient some hearing. Obviously costly, but this is going to solve many problems. Imagine a life where you cannot hear a sound, you cannot hear the music, the juvenile songs you cannot hear. Imagine a life, how deadly, how distressing, how difficult the light can be. But we have a solution for that today, right? The engineering genius, cochlear implant. Anything else? Any other surgery of the inner ear? Anatomy পড়া আছে তো inner ear এর? Very interesting one, anatomy and physiology of inner ear. We'll get a class on that, okay? There are many other surgeries, like we operate on labyrinthine system sometimes, labyrinthectomy, labyrinthectomy, endolymphatic sac decompression, okay? If there is suppose a leak on your dura and CSF is being leaked from your dura, from your brain, we call it CSF otorrhea. That is also a surgery. We will manage like this, with a surgery. Have you heard the word acoustic neuroma? What is that? Neuroma means it's a tumor, right, of vestibular nerve. Okay, so better to call it a vestibular schwannoma. Okay, acoustic neuroma is basically a misnomer, but vestibular schwannoma, it's a schwannoma of a vestibular nerve, sometimes inferior division, sometimes superior division. There are two vestibular nerves, right? You দেখছে না. So this is a kind of brain tumor you can call, and that is also the domain of ENT, also the domain of neurosurgery. Okay, so it's all about ear surgeries. So নাকের কোন সার্জারির নাম আছে জানা? DNS is not a surgery, it's a disease. What is its name? What does it Septoplasty, right? If you correct, what do you mean by plasty? It's correction, plastic surgery, correction of many deformities, right? So septoplasty, if you correct the septum, that is septoplasty. If you correct the tympanic membrane, it is Tympanoplasty, right? So septoplasty is a surgery. Likewise, submucosal resection of septum, it's also kind of septoplasty, but we give it a different name. That is also a surgery. If you change the shape of your nose, okay, someone tries to want to be like Aishwarya Rai. Suddenly she came to our office and asked me, I want to be like Aishwarya Rai, please change my shape of the nose. Can I do that? Yes, we can do, right? We cannot guarantee that he will be Aishwarya Rai, that is different thing, but we can change the shape, right? So that is known as rhinoplasty, okay? And here comes the other surgeries, the much more interesting and broader aspects of rhinology, that is our sinus related surgeries. We call it endoscopic sinus surgery, right? There are many paranasal sinuses. তাই তো কয়টা নাম বলা যাবে? Maxillary sinus, right? Next, frontal sinus. Next, ethmoid sinuses or sini. Okay, so there are many ethmoid sinus. Next, sphenoid sinus. তাই তো কটা sphenoid sinus থাকে? হ্যাঁ, কটা sphenoid sinus থাকে? Examiner যদি তোকে একটু কনফিউজ করতে চায়, they can ask this question. Only one sphenoid sinus is there, তাই তো? তার মধ্যে obviously partitions থাকে, but there is only one sphenoid sinus. So all these kinds of sinus related surgeries and the sinus related sinusitis, it can be sinus polyp, it can be sinus related tumors, okay? All this comes under a big umbrella, that is endoscopic sinus surgery, okay? And what more we can do? We can go beyond these sinuses, okay? Sinus idea ache to naki? The air-filled spaces just below your skull base, right? So if you can reach the sinuses, you can reach beyond the sinuses. So there are many important structures in your brain that we can reach beyond those sinuses. The most common one is pituitary gland, right? So we can access our pituitary gland through our sinuses, and the surgery becomes very simple, less morbid, and very quick, less complicated, right? So these are the common nose surgeries. What are the common throat surgeries? Tracheostomy. It's actually kind of neck surgery. It's not throat. Throat is a misnomer actually. That's why it's being correctly said. it has been anatomically subdivided, right? Your oral cavity, oral vestibule, oropharynx, pharynx, hypopharynx. Then there comes your larynx, your trachea, your esophagus, all these things. So tracheostomy, basically there is a kind of neck surgery, right? Anything else? Very common surgery. Thyroidectomy, okay, no problem. Next, thyroidectomy, then called parathyroidectomy also. Tonsillectomy, this is the most commonly performed surgery. Okay, this is the most commonly performed ENT surgeries. One of the most important and very frequently done. So tonsillectomy is a surgery. So all these surgeries, what I have now told you, you will be asked specific questions, of which few surgeries are very important undergraduate level because they are frequently done. So as a graduate doctor, I mean MBBS doctor, you should recognize the common complications of the surgery, right? We are not expecting you to, that a patient after a very critical thyroid cancer surgery will come to you with some complications. He or she may come, but it is your first job to recognize the complications so that you can refer those patients or do the advanced management with supervision, right? So tonsillectomy hoyeche, সেই পেশেন্টের তোমার complications জানতে হবে, তাই তো? So this tonsillectomy will be asked in the exam. 100% it will be asked. It will be asked again and again and again and again. Okay? How will you manage those complications? What is the most common complications of tonsillectomy? মোস্ট কমন কমপ্লিকেশন, একটা পেশেন্ট সাডেনলি এমার্জেন্সিতে রাত্রিবেলা এসছে, এটা বলছে যে আমার 4 দিন আগে টনসিলেক্টমি অপারেশন হয়েছিল, সেই ডাক্তারবাবু সার্জনকে আর রাত্রিবেলায় পাচ্ছি না আমি কোথাও, তাই তো এমার্জেন্সিতে এসছে, তো ফার্স্ট থিং তোমার মাথায় আসবে যে এই কমপ্লিকেশনটা হতে পারে, তাই তো? দ্যাট ইজ ব্লিডিং, ইজ দ্য মোস্ট কমন কমপ্লিকেশন. So bleeding after tonsillectomy will be asked again and again and again and again. Okay, in instrument they will ask, long case, in short case, everywhere they can ask. Likewise, Tympanoplasty or Myringoplasty will be asked. Likewise, septoplasty will be asked. Right? Got it? Okay. So now comes the instruments. So you have got already an idea that common instruments will be asked in your questions, right? বোঝা গেল কি কি সার্জারি বারবার জিজ্ঞেস করবে, তাই তো? So instruments will be asked about ENT instruments, I mean ear instruments, some specialized, because instrumenটের শেষ নেই, ওকে? তোমাকে সেগুলোই জিজ্ঞেস করা হবে which are widely available in your OPD or emergencies, okay? So that you can do your emergency and regular OPD works. You are not expected to learn about the many complicated endoscopes, okay? Many micro scissors, micro instruments, all these things, powered instruments, debrider, drill, coblator, laser. You are not expected to know these things, okay? You are expected to know few simple instruments like your tracheostomy tube, your ear instruments, regular ear instruments, nose speculums, tonsillectomy instruments, tracheostomy instruments. These are the things you are expected to know, okay? So আমরা সেটা একটা সেপারেট ক্লাস করব, ঠিক আছে? এবার রেডিওলজি, এক্স-রে, রাইট? এক্স-রে এর মধ্যে খুব কমন কিছু এক্স-রে দেওয়া হয়. Anyway, X-ray has a very limited role nowadays because most of the ENT radiology is basically CT scan, okay? It's say তোমার PNS related হোক or ER related হোক, we mostly depend on CT scans. But in undergraduate, you are not expected to know the complicated CT scans. So mostly X-ray তোমার তার মধ্যে হবে একটা সিম্পল ER X-ray থাকবে, mastoid এর, okay? প্যারানাসাল সাইনাসের এক্স-রে থাকবে এন্ড নেকের এক্স-রে থাকবে, ঠিক আছে? নেকের এক্স-রে এর মধ্যে কিছু অ্যাবসেস থাকবে, কিছু ফরেন বডিজ থাকবে, রাইট? So these are the simple things, but questions will be asked after that. Suppose there is a coin in your esophagus and you getting the X-ray, you will be asked how to differentiate whether this coin is in bronchus or esophagus, how will you remove it, what are the complications, like this. Questions will be asked after that. Okay, so we'll direct you towards that. What are the expected questions? What are the things that will be asked in your exams? So these are the things, 3 things that I will cover in this afternoon classes. Okay, so next day onwards, what do you want to learn? Surgery? Huh? Anything? Cases, long cases and short cases you are expected to learn in your clinical rotations. But if you wish to learn it, I will, okay, few cases I will tell you, okay, how to present those cases, okay? So next day we will go for a case of CSOM, right? Okay, that is the most commonly asked questions. Obviously, I cannot cover all the cases of the world. I will orient you only those important cases that mostly being asked in the exams. That does not mean that other things cannot be asked, right? Okay.